Tonight's live stream telecast is being produced by Jonny Nomad Media and Daytona Beach Live Stream Solutions. Up next in the Elevate Daytona Beach lineup, let's hear it for Dr. Delicia Haynes.
So I'm curious, how many of you believe that the doctor-patient relationship is, has been, and must always remain at the heart of healthcare? Good, I'm in the right room. My name is Dr. Delicia Haynes. I'm an award-winning entrepreneur. I'm the founder and CEO of Family First Health Center. And I like to help people transition to direct primary care. But I wasn't always that way. When I was in the 7th grade, I was taking a shower one day, and I noticed a lump in my breast. I was terrified. I told my mom, and she made an appointment at the doctor's office, and we waited hours in the waiting room before we got brought back. In walked the doctor, and me and my 7th grade enthusiasm says, "I want to be a doctor too." And he looked at me over his glasses and said, "Take your top off." I did. He walked over and just started pressing on my chest. And then he leaned back and he said, "It's probably a benign fibroadenoma. We won't know for sure until we have it surgically removed. Due to the location, the scar should be small, so if she wants to be a stripper when she grows up, that'll be fine." And he walked out the door. I was devastated. But in that minute, I decided that when I became a doctor, I was going to be the type of doctor I wish I had. And I set off on a path to do just that. I opened up my own practice, and that's when I was introduced to that third party in between the doctor and the patient that really shouldn't be there, but they exert a lot more influence, that third party being insurance. And I found myself over time having to hire more and more staff to take care of patients, but just to do the insurance part of things. And it got me thinking, what is insurance really meant for? So when we think of things like our car insurance, we don't use it for door dings and oil changes. We use it for the big stuff, catastrophic stuff. So why do we use our health insurance for sinus infections and enrollment exams and expect by using it that way that our premiums are somehow going to be low? Health insurance is important, but it's not the same thing as healthcare. And no doctor goes to medical school to take care of paperwork. We go to medical school because we love taking care of patients. Our current healthcare system is a bit of a mess. And if you look at all those things in between the doctor and the patient as a weight, an economic weight, of course the cost of healthcare is going to continue to go up. But there's a different way, and it's called kicking out the middleman. And that's what direct primary care is all about. So with direct primary care, patients get access to their doctor for a flat monthly fee. No copays, no insurance hassles, no deductibles. It's the healthcare you always wanted, when and where you need it. But it's not for everybody. If you want to wait for hours in a crowded room, then direct primary care is not for you. If you want to be not listened to and you want to be treated like a copay instead of a valued person, then direct primary care is not for you. But if you're the type of person who wants to have health care delivered with compassion and respect, then direct primary care may be for you. So it has a lot of features and benefits. One of them being that you can actually get in. So the average time to get into a doctor's office is about 6 months. Direct primary care doctors can often get their patients in same or next day. You also get longer one-on-one time with your doctor, which is crucial, because that's the time when you're sitting there and you're telling your doctor what's going on with you, they're listening and they're making an accurate diagnosis, which can be the difference between life and death. In this age of the pandemic, telemedicine has become a thing that everyone's doing. But direct primary care doctors didn't need a pandemic in order to use technology to take care of people. Our members had it all along. But it's not just about taking care of people when they're sick, because there's also things that we can do to help you optimize your health, whether it's spiritually, mentally, or physically. And direct primary care doctors take the time to help you walk away from your health fears and toward your health wishes. We're also amazing patient advocates. So if I'm the person that's writing for the x-ray or I'm writing for the lab work, I'm also the person that's uniquely qualified to negotiate for the highest quality at the lowest rate. And in that way, direct primary care doctors like myself help to save people thousands of dollars and decrease the cost of healthcare. And those cost savings are translated directly to our members. So you don't always know exactly how much something is going to cost. There's never a mail that comes with a bill 3 weeks later. You know exactly what it's going to be. So whether you're single, married, or a business owner like myself who wanted to attract and retain your top talent, direct primary care is a fantastic option. It's also the fastest growing movement in the United States, and I'm proud to have inspired and coached hundreds of doctors to make this change. Because this is the future of medicine. So it's time to take a hard look at what's standing in between us and the healthcare that we want. Whether you're a doctor or a patient, whatever that red tape is that's keeping you away from having relevant, revolutionary healthcare, it's time to cut it.